Have at it.
Go ahead.
Okay. Good afternoon, everyone. We are here for our Board of Health meeting, October 3rd. I want to welcome everybody. We'll just do a short round of intros, and then we'll go in a little deeper intro with you guys. So I'm Bobby, Director of Public Health.
Schaefer, Assistant Director.
And Lindsay, Montezuma County Commissioner.
I'm Candelaria, County Commissioner.
Gerald Copenhagen for County Commissioner.
Niana Phillips, Prevention Grants Coordinator.
Woods, Emergency Management and Management Preparedness Coordinator.
Thank you. Did everybody have a chance to read the July minutes? Any changes? No. We approve it? All right, thank you. Okay. Agenda here are the introduction of our new staff. So, as you already heard, Trent Woods is our new coordinator. He is also doing child passenger safety seats. We had a clinic there today, had several successful seat installations. He is also our communications person, and he is also the support of approximately 10 hours a week to our emergency manager, to Jim Spratlin. So give or take that, those hours can flex a little bit depending on how Jim needs him, but it's a 40-hour position. So he's our full-time keeper coordinator. So welcome, Trent. So these are the three commissioners, and this is our Board of Health. And then Niana Phillips is our coordinator for the Colorado National Collaborative, the CNC Suicide Prevention Model. So Niana is basically, Katie has been working, you remember Katie, right? So Katie Maxwell, she's still with us, but we have transitioning her into a different role, and Niana is taking over that role that Katie did with the CNC program. So, and I think this is your first week solo, right? With Katie around, but...
Yeah, it is. Thank you.
I was just going to ask him, where do you come from? Are you local? I mean, tell us a little bit about yourself.
Okay, I guess so. Yeah, I would say I'm pretty local just because I'm off the little reservation over there in Aneth, if you know where Aneth Utah's at. Live there. My family's there. Went to high school there. Graduated with my associates from USU in Blanding, and then went off to Albuquerque, New Mexico. Got my bachelor's in Albuquerque, New Mexico at UNM. And then I came back. I got my bachelor's in public health, so I thought this job was very fitting for what I do and my job, or my education background. But yeah. Yeah, and so like Cortez was the closest Walmart we had, so I feel like I'm part of your community.
Oh, no, I mean, obviously, some of us have worked out in Aneth for many, many years. Back in the day, probably prior to you being born, right?
Oh yeah? What do you guys do?
Spend a lot of
Look at
time.
that. First thing she did was looking over here at the old.
I was in construction, so
Oh, okay.
a lot of work out in Aneth, Landing, White Mesa. I've worked over there for years.
Sweet. Okay.
So, yeah, real familiar with that entire area.
That's good. You know how small it is then.
So Gerald, don't feel bad, because when we did our interview process with Niana, I told her that I was part of the silver tsunami in public health. And she remembered that, and she thought that was actually pretty cool. So that's why she wanted to work for us. No.
Yeah.
Yeah, I'm Trent Woods from La Plata. I was born and raised in Durango, and my wife is born and raised here in Cortez. I completed an Associate of Science in Emergency Medicine at Pueblo Community College in Durango, and I've been worked in medical laboratories and in the medical field in EMS and primary care for a long time. We moved to Denver area and attended MSU, and I studied cellular molecular biology, holistic human health, which is a lot of health and human service type stuff, and then chemistry and human nutrition, and worked in emergency medicine in the South Denver area, doing a lot of clinical proficiencies, and doing a lot of trainings for folks. And then my wife and I, in the, I guess, spring of 2020 during peak of COVID, beginning of COVID, we're ready to head back out of the city and kind of get back home and bring our skill sets home. So we came back here, and also we were pregnant with a child at the time and wanted to raise our kid out of the city. So we moved back here, and I worked at Southwest Health until this year, when then I transitioned over to the health department. And so I bring about 18 years of medical experience in emergency medicine, and yeah,
Very good. Well, thank you and welcome board.
thank you.
We're very excited to have both of these guys on board. They're going to be a real asset to our community. So I know both of you have an appointment with someone, actually Greg Felson. They're meeting Greg in just a short period of time. So if you guys, anytime you want to exit, feel free to go ahead and just get up and you can head out, okay? The other thing, well, while we're talking about, so as far as staffing goes, we still do have 4 openings in our department. So we have the public health nurse position that's been open for over a year, I think now. And then we have another public health nurse position, which is our nurse-family partnership. One of our nurses resigned from that role. So we have 2 of those nursing positions open. We just received a resignation last week from our Communities That Care coordinator. Tricia Hellenkak is moving on to a different position. And then our environmental health position is open. So we still have 4 openings. It was, but it isn't now. So, yeah. So we have 4 positions open. So, yeah, I mean, the staffing retention continues to be an ongoing issue everywhere. I mean, it's not just us by any stretch, but yeah. So, anyway, so I just thought I would put that in to inform you of where we are with staffing. I think it's really, I like bringing our new staff. This worked out really well with the Board of Health to bring our new staff. I will try to do that. It's just with it being quarterly, sometimes it doesn't work. So, I'll try to do it at the BOCC, but this is ideal, I think, to kind of the actual positions, fill you guys in on any questions you might have about them right off the bat. And so, thank you guys for coming. Mm-hmm.
Well, I'm going to ask you a question for both of you. One, welcome, obviously, which I've done that, but man, we pension situation and I hope you fit. What are you looking for in your lives? I don't know if that's a fair question to ask here or not, but what are you looking for as you?
I'm actually pretty committed to this job. I just moved from Aneth, Utah to here because the commute was crazy. So I moved to Macus, and I like public health, and I was doing nursing, but nursing wasn't a call to me, and so I switched over and I was doing public health, and I actually really liked it. And I was reading, it's funny because I interviewed for his position and he interviewed for my position. And after I found out what his position was, I was like, actually, I really like the other position more than this position. And I was like, I think it's more fitting for me, and I like that work, and I enjoy that kind of work, and I think I'm going to be a good asset to this work, which is good. And anyway, I can help the county. So I prayed about it and just kind of fell in my lap. I was looking everywhere. Everything was like kind of out of my range, and I was like, this is too crazy. I don't know if I'm going to be able to like find a place by the time. Then I started considering getting a fifth wheel. And then I was like, that's just going to equal out to the same amount. So I was like, okay. I went on Facebook Marketplace and I found this place in Macus for like $6.75 a month with all utilities like included. So I was like, that's a steal. So I got it and everything's going well. It's really, really pretty little place that I found. But it's good. I don't think they're gonna move it up or anything, so hopefully they don't, and I get to stay there longer.
And what about for you, Chris? Did you have any issue with housing?
You know, we were very blessed and fortunate to have the opportunity to buy a house here over by Mesa Elementary when the market blew up over here and real estate prices were increasing and also all the interest rates were down. So I think we got in at a very fortunate point in time because since then I've spoken with a lot of people who are struggling a lot more because my real estate prices have grown, and that's one of the difficulties that me and all the community of people that I grew up with in Durango have faced. Even though we've gone out and gotten professional degrees and come back, the real estate market over there is outpriced people who are born there. And that's been a very big challenge. So I feel really lucky to be able to do what I want to do here. Close on my house, January 2021. It's kind of right. As far as motivations for working in public health or in general is, we grew up in a family that had a strong spirit of, work with, like, life of service. My dad was a combatant in Vietnam, both my older brothers were Marines. My mom worked as a medical technologist, working in medicine. And so really life of service and serving my community is a big family value. And so that's what I think when I was unable to serve in the Marine Corps, which was longer than I was able to go into emergency medicine. But then,
I don't know. Welcome.
I heard that a lot in the Plata County, through the fire service, the quite a few of the fire guys over there. They all work Durango Fire, but none of them, I shouldn't say none of them, a big percentage of them don't live here.
and homeownership is better.
They cannot live in the community that they should. Which is kind of cool.
Thank you guys for sharing. Okay. Yes, feel free. And that's our county administrator, Travis. So when you hear me talk about Travis, it's always good, Travis. Okay. Alrighty. So moving on, I thought I didn't necessarily get any feedback of what you all would like to focus on today. So what I thought was I would just kind of touch base a little bit on some of the communicable stuff that we have had this past year and kind of where we are with just where we are with things. So well, I'll start with COVID. So basically, as far as what's going on right now in our community, not throughout the state, but in Montezuma County right now, we have no COVID outbreaks going on at the time. There's been, for the month of September, we had 47 cases of COVID, and so far in October, we've had 3. So it's definitely much more manageable than historically. As far as vaccine goes, for those who are interested in getting the COVID vaccine, for us in public health, we have limited supply of the Moderna COVID-19 vaccine for adults who qualify for the Bridge Access Program. And the Bridge Access Program, if you're not familiar with that, that's for adults who have no insurance or have a health insurance plan that does not cover the new COVID vaccine. Those who are on Medicare or Medicaid are not eligible for the Bridge Access Program. So for us at the health department, That means that we are not providing COVID vaccine to the general public unless you fall into that bridge access program. Let's see. If currently we are not doing COVID vaccine through the VFC program, which is the Vaccine for Children program, because we don't have any requests for it at this time. Now, if we do get requests, parents who have children that are eligible for VFC, we will reevaluate that if we get parents who would like to have that vaccine for their kids. Let's see. The recommendation from the Advisory Committee on Immunization Practices, which is ACIP. You'll hear people talk about ACIP, and that's who it is, the Advisory Committee on Immunization Practices, recommended on September 12th for the updated 23-24 mRNA, Moderna, and Pfizer vaccines to be given to everyone age 6 months and older. And then there's a lot of nuances to what vaccine, who should get at what age. And my recommendation is you can go to the CDC website and get that information. You can call our health department and we can give you all those details of where you fit. But it is out there. The guidelines are out there. And we do also have this posted on our website. So, any questions about COVID and the vaccine?
Do we have, I mean, you're short 2 nurses.
Mm-hmm.
Do we have enough staff that can give vaccines?
Yeah.
Go through a big clinic or something?
Right. So we are able to do our immunization clinic the way we normally function. The one place it is impacting us it has to do with our off-site flu clinics that we historically might do for businesses. We are still available. We can do the immunizations for businesses, but in our department. Okay. So basically, it's the off-site flu clinics that are going to be impacted. But our immunization team is blocking out specific days and times, and any community partner or business who wants to get their flu vaccinations, we will take care of you. We just need to communicate with us. But we're not going to be going out to organizations. As far as the county goes for flu, we already have that date set up for county employees, which includes all of you. If you want to get a flu vaccine on October 18th from 3 to 5. And I do believe email went out about that. So the flu vaccines are now available. Anyone 6 months and older. At the health department, we're accepting the VFC and most private insurance. We don't do Medicare. There's plenty of opportunity for people to go places and have Medicare pay for that. It is $30 to have the flu vaccine provided by us in the department. Any questions about flu? Okay.
I ask you this all the time. What's the lottery for type flu this year?
You know,
Dark word guess.
I can't honestly answer. I mean, I have an answer at the top of my head, but I don't know if it's accurate, so I don't want to say it. So RSV, that's a new immunization that is available. We are not giving the RSV vaccine at the health department.
Advertisements for that.
It's being available for babies, pregnant women, 60 plus, and there are. Oh my goodness. Okay, so Southwest Memorial and other pharmacies are carrying the vaccine for those folks who are interested. Medicare is covering the RSV vaccine, and I have a price quote, but it's from one institution of $350 for the RSV. Okay. West Nile, unprecedented outbreak of West Nile throughout the state this year. As of September 20th, there were 452 cases throughout the state and 21 deaths in the state of Colorado. So CDPHE, the State Department, believes that we have peaked, and traditionally we have peaked because the mosquito population is trending downward. In our county, specifically, we had 5 cases. I don't recall having 5 cases that I ever, since I've been,
Localized in a certain area?
no.
Across
no.
the board?
So 5 cases, 3 cases were hospitalized on the Front Range, but they've all recovered and we had no deaths. So again, they're most active. West Nile is most active in the summer and early fall, and they're stating that the reason it was so just go out. There we go. Due to the snowfall last year and the wetter spring that we had, that's why the mosquito population was so prevalent. And we have tips and recommendations on our website of how you can reduce your risk. Any questions on West Nile? Okay. Plague. So the bacteria, Yersinia pestis. We have no new activity or cases here in our county since June. We had the 1 confirmed, the 1 suspect, and we have had no deaths. There was a recent human plague case in Archuleta County, and that resulted in a death. That was recent. Again, you get that from the fleas off of several kinds of animals, rodents. Cats can carry it. They can get sick with it. Dogs can get it, but they typically don't get sick from it, and they're not such carriers as badly as cats. But obviously, we all know that prairie dogs carry it, but there's other things: mice, voles, squirrels, ground squirrels, tree squirrels, rabbits. So they're all, and maybe there's more. I don't know. I'm looking at you, Commissioner Copenhaver, if I'm missing an animal that might be carry the fleas.
There's more of them than you can name.
Oh, okay. All right. Well, so yeah, it's been kind of been a different year this year for us in communicable disease, and then again with the rabies. So that's the next virus we can talk a bit about. We had 5 individuals treated with rabies PEP in August for bat exposures, and the bats were found in 2 separate homes. We were not able to test some of those bats because the homeowners let them loose or were unable to contain the bat. So they were treated prophylactically with the rabies PEP. The big thing with rabies is if you suspect that you have been potentially bitten, again, remember with a bat, you're not going to necessarily see the bite marks. So if you find a bat in your home, you need to assume you've been bitten. And get the treatment because rabies, if you do have rabies, rabies is fatal most times if you're not treated. So, and it is treatable. So, I'm not sure. I did get a quote of what the cost was, but I can't remember the exact number, so I don't want to say what it is. But it's expensive. Some insurances do cover it. So, anyway. Any questions about rabies?
I think probably 7 or 8 years ago, that was like $1,600.
Yeah, that sounds about right. It's very expensive.
Higher than that now, but
Yeah.
it's what it cost there.
Yeah, and it's a series of 3 because you get one the day you get bit and you go in for treatment. They want to give the injection closest to the site, the bite site. Correct me if I'm saying anything wrong here, but it's closest to the bite site. And then there's 2 additional, and I can't remember if they're a couple weeks apart or if it's a month apart, I can't remember.
Yeah,
But-
yeah, the first two are pretty close together, and then it
Right.
gets a little,
Right,
time-wise, I don't remember exactly.
right.
Yeah, it's not cheap.
No, it's not. But you know, if there's even a possibility that you've been bit, it's worth to do it because there's no treatment for it once you've got rabies. So anyway,
Be fatal.
yeah, yeah. So, what'd you say?
When you get bit by a bat,
Don't get bitten by a bat.
what do you, I mean, if you find a dead bat laying around,
Dead bat,
you just throw it away? You suppose our guys at the landfill?
you can bury it.
Okay. The dog beat you up.
Yeah, you ideally there's a whole procedure of how to catch a bat. There's been, you can read, like some people take a broom and kind of sweep it into and then try to catch. But the big thing is you don't want to end up touching that bat or have that bat touch you. So you need to be smart and sensible and how you handle the bat. So, and then we have a vet that works with us to euthanize the bat, and then we have sent it off to the state lab. So, yeah. Any questions? Okay. I don't necessarily have anything else for the Board of Health. Do you have anything, Laurel?
No.
I asked her that yesterday, and she did the same thing. She wiggled and smiled and said no. And I know she's biting her tongue.
Yeah.
I really don't have anything pertaining to the Board of Health.
Yeah, that's
That's
the key. All right.
Suggestions for next board?
Yes. Second, 2024.
January 2nd?
I know. 'Cause I think, County Administrator, we're closed on the 1st? Yes? Did you set the holidays? Don't you usually set the New Year's one, though, at the end of last year? No? I think you do.
I don't think we did.
Oh, I think you did. Yeah. Okay, we're gonna stick with. I'm not going to bet with them. Mm-mm. So. So January 2nd, we're sticking with it in 2024 at 1:30 for our Board of Health. So if you think of something specific that you want us to
Maybe we should talk about hangover cures.
hangover cures.
Yeah, for the second, the day after.
Oh. Okay. I'm like, I wasn't following you at all there.
That we could talk about, because we've talked about this in the past, and I think that obviously with our health insurance updates of what our costs are for insurance, I still think that public health, we should be talking more about what does it take to take care of you. Because healthcare starts with each individual. Are you sleeping right? Are you eating right? Are you getting outside enough? I mean, what are the key factors to good health? And really, for our entire group of people, our county employees, because I think at times that we get so caught up in our day-to-day activities of raising a family or doing whatever that you can forget about it. Some of the simple things and bad habits are easy to hang on to. Good habits are not so easy to.
They're not sustainable, or we think they're not sustainable.
So, I mean, really, I think everybody's kind of inside, it's
Could be that time of year to really try and.
try and get, what constitutes good health? What do you need to do for good health? I mean, that is public health.
we had a discussion the other day, centered around annual physicals. You know, go get it. Don't waste that money.
That's what I would like
Get that,
to see.
get that blood
So,
work, you know.
So
but it's for everybody.
I totally hear what you're saying. I agree with you, but I'm going to go back to what the core functions of a public health department is. Does that align? It doesn't necessarily. However, we do community health assessments. And our work, when we did our last assessment, and we're gearing up to get ready to do another one in 24. Basically behavioral health was the focus, was the voice of our community. We want to do another assessment. We're working on with our team to figure out what that's going to look like. But I think it'd be really interesting to do an assessment post-COVID, because when we did the other one, it was pre-COVID. So, and prior to COVID, it was behavioral health, mental health, substance use and abuse. Those were the issues pre. It would be interesting to see what they are post, and if it's the same or if there are different issues. So.
Different and higher.
I was saying but much higher. My guess.
Yeah.
Correct. That would be my thought.
So we're gearing up for that. So in what you're saying is totally accurate, and that would be how I would blend that into our purpose in the public health department of assessing what our needs are in this community, and how we find that out. How do we go about getting that information, and then what do we do to work toward it, to improve it. So, we'll formulate something around this, but it'll kind of, we'll try to blend it into what fits with our role, if that makes sense.
Are we taking care of our cancer exposures? You know,
Mhm.
should be. Cardiac exposures, those kinds of things, as a community as a whole.
When some of that data,
Some of it's old.
well, and that's always the problem with data. So it's not like just-in-time information, like right now, like this year. No, it's like at least 2 years old, if not more. So it's not necessarily current. Now we are working on. We're part of a opportunity we signed up for through the state, where we're getting on to a database where we can get local information, do our local assessments, and gather our local information. It's our information. It's not necessarily owned by anyone else. So we have taken the steps to join that, and that's part of what Katie is going to be working on in our department. So I don't know, do you want to add to that, about that system?
I think it has a rural focus. And so that's where a lot of times, a lot of data is suppressed. So kind of being able to voice our concerns and our lack of data that we are often looking for. And I think it'll be a good pilot program to at least try. Katie's got a really good data background. She does a lot of that with the state, so.
Delve into the other programs like vision, hearing, dental. I mean, we do dental there, but a lot of people don't realize if you get a good tooth infection, it'll really screw you up.
Yeah. No, these are all really important issues. But I'll go back to the basics, when you don't have a roof over your head, and you don't have clothes on your back, and you don't have food to eat. None of those things. It's not going to be important to the population. So we have to think about the entire population of our county, and figuring out, getting all the voices to tell us what their issues are. not just, the working class with insurance, right? We need everybody to find out what our needs are and try to help every single person. And so it is big picture work, but it's super important, and oftentimes it's just baby steps. It's small steps. We all may never see the results of the work. It's going to be 10 years down the road, and we're no longer in these roles anymore. So anyway. No, that is not what I'm saying at all. Not at all. Oh my God. Okay. Well, I appreciate the suggestion, and we will formulate something, and maybe we'll get Katie in on our conversation with us. So, all right. All right. Well, thank you all, and we'll see you on January 2nd.